Are vaccine titers something you want to explore with your veterinarian? My name is Dr. Michael Dim, and I'm a holistic veterinarian here in West Palm Beach, Florida. I offer in-person consultations in my home for clients in the South Florida area, and I welcome clients nationwide through telemedicine and phone consultations. So in this talk, I want to review vaccine titers, a little background on how they developed, what are they useful, some limitations with their measurement, and what are my ultimate recommendations regarding vaccine titers? Well, as far back as the 1970s, we go back there, the late immunologist, Dr. Ron Schultz, a very prestigious veterinary immunologist, wrote in a veterinary textbook called Kirk's Current Veterinary Therapy that immunity to core viral vaccines that were given at that time, the main core ones were parvo and distemper, that immunity lasts for years, if not the life of the animal. And that was, again, over 50 years ago. However, my colleagues have continued to mostly vaccinate animals every year, and now it's more of a standard to do it every 3 years. But that's still way overkill in most circumstances. Now, why would we want to be concerned about vaccinating more frequently versus less frequently? Well, when I went to a veterinary meeting back in 1997, when I was just out of school 4 or 5 years, it was really an unbelievable meeting up in Burlington, Vermont. And at that time, one of the veterinarians, who was actually a teacher of mine at Penn, Dr. Larry Glickman, presented information that actually was quite astounding at the time. He actually published that animals that were vaccinated developed antibodies against their own tissues in their bodies. In other words, their immune systems reacting against their own self. So he found that they were developing antibodies to the thyroid gland, various connective tissue in the body, the DNA of the patient, that's where genetic material rests, and even the heart valves of patients. So in other words, antibodies against the heart valve. And when we see that, we eventually get diseases, autoimmune diseases, and eventually cancer if it affects the DNA. And he published information on that back in 1997. That was an amazing year because that year also, it was the first international vaccine immunology conference that actually showed that animals, again, were protected by measuring certain blood tests known as antibodies to these core viruses for years, if not their whole life. And those core antibodies are known as titers. So when we measure titers in our animal patients, we're actually measuring, an immune response to certain infectious diseases, whether by natural exposure or through vaccination. And the results of that conference in 1997 actually showed, again, that the immunity lasts for many, many years, if not the life of the patient. So I came back from that veterinary conference, and I actually brought it up to my boss at the time. Again, I was just out of school a few years. And he said, wow, that's wonderful. We want to do what's best for these animals. We don't want to over-vaccinate them, and we'll make more money doing titers. That was his actually other justification for doing them. So we started doing them, and we found that most animals had very, very high antibody levels, meaning they were protected against certain core viral vaccines, core viruses. However, there were also some animals that had very, very low antibodies or low titers. And so the labs at the time were suggesting that you might want to consider vaccinating those. But viral immunity is a very complex issue in animals as well as people. In fact, animals that have low titers or negative titers are often very protected against the same diseases. So again, we were measuring titers, and some of them were low. And so I asked my colleague and professor at the time, Dr. Jean Dodds, what do we do with that? And she told me most of these animals with viral immunity, it's actually memory cells of the immune system that are most important for protection against various infectious diseases. And so that was a learning thing for me to say that why run these titer tests if they're low or negative, that they're still protected? Why spend the money of clients and, even run these tests? And so, when would we want to use what are called antibody titer tests in our animal patients? Well, you can use it when they're puppies or kittens, when they're young. And that's a time when they're most susceptible to certain infectious diseases. With cats, it's often, kitty parvovirus, known as panleukopenia. With dogs, it's known as, we see parvovirus and distemper. So we may want to measure titers in young puppies and kittens to see whether they're actually, susceptible, whether they have antibodies in their bloodstream. And so that would be a time that we might want to consider measuring titers. The other time we could consider it is when we want to use it in a way that, let's say, to avoid the vaccination process in boarding situations or in shelters or rescues to see whether an animal even needs the shot. So we will often do, measure titers in those situations. Also, with rabies vaccine, titers can also be used as an alternative as well. The law with rabies says that all puppies and kittens should have rabies vaccine at a minimum of 12 weeks of age and then boosted at a year of age, and then every 3 years after that. But studies have shown that through the Rabies Challenge Fund, that rabies immunity actually lasts for, again, many, many years, 5, 7 years, or even longer. So titers might come into play where we actually can, document that in certain states now that are now honoring that instead of routine 3-year vaccinations. Okay, so drug companies have actually come out with blood tests now that veterinarians can do right in the office that measure a vaccine titer, that measure a titer. And the titer test is like a heartworm test. It's either yes or no. The animal's either positive or negative. Well, unfortunately, that test is also not very accurate. And so veterinarians are running these tests. They'll often show that they're negative, and then they'll end up vaccinating animals right there in the office. So if you do decide to have a titer test run, I recommend sending it out to a lab, a reference lab, such as IDEXX or Antech Diagnostics, and they quantify the vaccine titer measurement. And as I said, any measurable titer shows protection, and even a negative titer as well. But again, if we're going to run these tests, we want to do them right. We don't want to do the in-house yes or no test that's run in the veterinary office. So my recommendations on titers are that they are very, very, useful in certain circumstances in puppies or kittens when we're trying to see if they have adequate antibodies. And they're also useful when we want to avoid vaccines in, boarding and kenneling situations. Certain international travel requires measurements of titers, especially rabies. So those would be circumstances where we would want to measure titers. However, in my experience of measuring them in over now almost 30 years, more than most veterinarians in the country, I feel that it's a test that really you as animal guardians don't need to spend your money on. Because as the late Ron Schultz used to say, one and done is often needed. And that means if you get a single vaccine as a puppy or a kitten over 16 weeks of age, that immunity lasts for years, if not the life of the patient. So why bother to measure the titers if they can be negative in some cases and positive in others? And so they are useful, but they're not the perfect test. My name is Dr. Michael Dim, and I'm a holistic veterinarian here in West Palm Beach, Florida. I offer in-person consultations in my home, and I offer phone consultations nationwide.